As a family physician, it's not unusual for my schedule to be kind of packed full of patients who might be diabetic, which is not controlled, oftentimes insulin dependent. They probably are hypertensive, and that may not be controlled. Patients, it's not unusual for me to see a patient who's 400 pounds or over, which is a very, very serious risk to their health, and oftentimes they don't really have a good grasp of why that is. And so that's a concern. They may already be in heart failure. They may have COPD. They're probably smokers. They may have serious edema. They're depressed. And so we're asked to fit that in where I practice. So that's a 15-minute visit. People that work in administration are so disconnected. They really, they truly, they do not know what we are doing. They do not know what goes on in the exam room. They do know that they will bring in more resources, in other words, money, for their organization if I'm seeing more patients. And so essentially, I don't think that they've ever used these words, but I guess I'm going to go out on a limb. My impression of what they say to me, and they may not use these exact words, but my impression is that physicians we are dumb and we're inefficient if we can't move that complex patient through the office in 15 minutes. And so, obviously that leads to a great deal of frustration. I guess in the 12 years I've practiced, I probably less than a handful of times have I ever gone into the office not feeling like today is going to be a different day, because today I'm going to stay on task with my schedule, because probably it is my fault, because that's what I've always been told. It's my fault that I am not on time with these patients, and it doesn't matter. If you have that patient in the office and they're having chest pain, which is not unusual, now it's simple because now we know they got to get to the ER. Okay, that's good, but I still need to have the time to check that patient out to the ER physician. I need to have time to explain to our security guards that there's an ambulance that's going to be coming soon. I do need to get an EKG to see if they're stable or not. So that's not simple. That's not a 15-minute visit. And when healthcare is based on this disconnect, I'm being dictated to by someone who's never seen a patient in the office. They don't even know what I'm doing, but they're telling me that I'm dumb and inefficient because I'm taking this patient, this complex, high-risk patient, seriously. And I'm doing that EKG. I'm getting them to the hospital because they might die if I don't. And I think the reason I still do this is because I have so many patients that have actually gotten to the hospital in time and come back and said, thank you, you saved my life. That's what medicine is about. But still, at the end of the day, I go home and I beat myself up. And my husband has to, that's why he's here with me, because he's suffered through this for the last 12 years. And there's test results, there's patient phone calls. Where I work, it's not unusual for us to have 50 phone calls at the end of the day for me personally to have to respond to. That doesn't mean I have to call the patient, but I have to send my nurse a note back to explain what needs to happen for that patient. It's not unusual for me. I'm supposed to be done at 5, I work until at least 7 most days of the week, and then I work probably at least an extra 8 hours on the weekend. So basically what it boils down to is, 11 to 12 hours a day plus extra time on the weekend. And I have a family, and I guess, I think I feel blessed because I feel like I do have, I have a stillness in my heart that does allow me to cope with this and still just pour all my love to my children, especially at the end of the day, that I guess I have a special husband. I really do. I'm so blessed to have that. But I've been telling him for about the last 12 years, I'm going to have time for you tomorrow, and I promise. It's never happened, it's never happened yet, but he still has faith in me.
Yeah, absolutely. So. I'm curious what the change that you saw. If I have this right, you reached out to Pamela first about this workshop and kind of looking up online what other options might be after seeing what your wife is been dealing with. So what was the change that you saw? I mean, what kind of...
Well, you know, we've since before she even started medical school, so we've kind of gone through this journey together, and I don't know that our marriage could have survived otherwise, because I've seen her go from, you know, a very idealistic, you know, doctor to somebody who's extremely frustrated, just beaten up, just abused even. I would, you know, would not hesitate to use the word abused.